It's my pleasure to start now with the presentation of the already somehow historical data which had been collected with this new stent device. I'm happy not being the one who has to present the theoretical background. It's much easier to present positive clinical data outcomes. So basically, we have two aspects to consider with this three-dimensional helical stent design. We have heard already about the change in flow pattern in terms of inducing a swirling flow, and by this potentially reducing neointimal hyperproliferation. But equally important is by this helical shape of the stent, if the leg is bended, the axial compression forces of the artery which are applied to the stent are much better absorbed. And this does not only result in a less pronounced kink of the artery outside of the stented segment, but also reduces the mechanical forces applied to the stent. And with this, we have not yet seen any stent fracture up to 3-year follow-up with this particular stent design. So we have, number one, a change in flow pattern. Number two, the design increases the fracture resistance of this particular stent. So let's start with the MIMICS randomized controlled trial. I already mentioned that initially we started with a kind of first-in-man lead-in phase where we implanted biomimics stents in 10 consecutive patients. These patients had then been included into the prospective randomized study, which was a pilot study initially, but surprisingly at the end we found already with this small sample size, it was a 2-to-1 randomization, significant differences between the biomimic stent and the straight nitinol stent. If you look here on the primary patency, well, it's borderline significant difference. It's 72% for the biomimic stent and 55% for the live stent, which was at the time when the study was designed, the best in class slotted tube nitinol stent. Looking on freedom from clinical target lesion revascularization between 1 and 2 years, which is a so-called landmark analysis, shows then a significant difference favoring the outcome of the biomimic stent. There was freedom from reintervention of 91% between 1 and 2 years as compared to 76% for the live stent. So this study provided the first clinical proof supporting the durable outcome benefit arising from the biomimic's three-dimensional swirling flow stent compared to the straight nitinol stent, which was, as already mentioned, the live stent. So this is an overview about the entire MIMICS clinical program. I will also report the MIMICS 2 study outcomes and MIMICS 3D, and the US trial outcomes will then be presented by Michael Lichtenberg. So overall, so far, more than 1,700 patients had been enrolled into the MIMICS clinical study program. So MIMICS 2 was the IDE study for the approval of the device in the US and also in Japan. So overall, 271 patients had been enrolled into this single-arm study with a 3-year follow-up, which is completed. The primary endpoint was a safety, which was a composite of death, major amputation, and clinical-driven target lesion revascularization through 30 days. And the effectiveness endpoint was the primary patency at 12 months follow-up. As already mentioned, the follow-up was extended to 3 years. 43 investigational sites enrolled those 271 subjects. The majority was enrolled in the US. There was independent collab adjudication of the ultrasound images, of the angiograms, and also of the X-ray images in order to identify potential stent fractures. There was also an independent clinical events committee implemented to adjudicate adverse events. These are the baseline demographics. Nothing really surprising, except that the percentage of patients suffering from diabetes mellitus was unusually high. It was 45%. Usually we find about 1/3 of patients presenting with diabetes mellitus in these SFA studies. If you look now on the lesion and vessel characteristics, all lesions had been de novo lesions. Most of the lesion locations had been in the mid and distal part of the SFA or proximal popliteal artery. The mean diameter stenosis was about 78%. Lesion length was meaningful, a mean of 8 centimeters, and total occlusions had been present in 30%. The degree of calcification was rated as being moderate to severe by the COLAB in almost 50% of the cases. This is going back to the previous question we already discussed. The overall standard length was 11 centimeters, and this shows that the strategy of stent placement within this particular study was to implant the stent from healthy to healthy vessel segments, considering that mean lesion length was about 8 centimeters. Following the procedure, there was obviously no relevant dissection found in the stent study. Device and technical success was 100%. So now the primary safety endpoint, this was 99.6% at 30 days as compared to 88%, which was the performance goal. So the difference was significantly in favor of the biomimic stent. And if you look into the primary effectiveness endpoint, which was primary patency at 1 year, it was also above the performance goal of 66%. Important is to look on the range of the confidence interval. This was above the performance goal cutoff value. That means that the higher primary patency rate was significantly above the performance goal, showing the effectiveness as compared to the OPG. This is now the long-term outcome with regard to freedom from clinical driven target lesion revascularization up to 3 years, which is 81%, which is, I would say, outstanding. There was only a slight decrease between 1 and 3 years of 8% of freedom from reintervention for this stent, which confirms the finding of the randomized controlled study. Now let's have a look into subcohorts, and let's start with lesion calcification. Here, this is the comparison between none and mild calcification as compared to moderate or severe. And we can nicely see that at 3 years, there is basically no difference in terms of freedom from reintervention. There's even a slight trend towards higher freedom from reintervention for the calcified vessels. Now the comparison between chronic total occlusions and stenosis, as already mentioned, 30% of the lesions had been CTOs. And again, if you look on freedom from reintervention up to 3 years, no significant difference. A slight trend towards a better outcome for stenotic lesions. If you look now into lesion length analysis, building up terciles with lesion lengths up to 65 millimeter and 65 to 100 and lesion lengths of more than 100 millimeters, again, there was no significant difference between those 3 terciles. It's important now to compare the outcome of the MIMIX-2 study with previously published study data from the Supera stent, from the Live stent, which is the best-in-class slotted tube stent, the Silver PTX drug-eluting stent, the Illuvia drug-eluting stent, and the Impact Admiral drug-coated balloon. So for those devices, we have also 3-year freedom from reintervention data available. Here, as already mentioned, we have about 80% freedom from 81% freedom from reintervention for the biomimic stent, which is more or less equivalent to what was published for the Supera stent in the Superb trial. Also, the outcome for the Live stent was even slightly inferior. Silver PTX, obviously no significant difference, even if we cannot directly compare the outcome with regard to freedom from reintervention. And the same holds true for the Illuvia stent and Impact Admiral stent. So what was already mentioned during the 2 previous presentations, it seems that inducing the swirling flow into longer lesions has some kind of protective effect against re-stenosis development without drug application. So, in summary, the MIMIX-2 study shows reproducible, rigorous, high-quality data from the US, Japan, and Europe. We found 81% freedom from clinical-driven target lesion revascularization at 3 years. If we compare the outcome, the reintervention or the freedom from reintervention seems to be very much comparable to drug-coated balloon, drug-eluting stent, and interwoven stent study data. And this is important, there was a 0% stent fracture rate also up to 3 years within the MIMIX-2 study. So the MIMIX-3D stent reduces the burden of reintervention for the patient and the healthcare system. Thank you very much for your attention.